amid the festive season, the centre has issued an advisory to citizens to follow Covid-19 precautions. The government has said that amid the festive season, there should be online shopping, avoid unnecessary travel, and if cases are spiraling in other parts of the world, the government has also suggested that all mass gatherings should be banned in containment zones and in areas where the positivity rate is more than 5%. Well, what are the do's and don'ts this festive season? What should you keep in mind whether you're vaccinated or not? Joining us on the broadcast, we have Dr. Rajesh Parikh. He is the Medical Director Research at the Jaslok Hospital in Mumbai. We also have Dr. Romil Tikku, Associate Director Internal Medicine, Max Healthcare. Thank you, doctors, very much for being with us this morning. Dr. Tikku, I want to begin by asking you, because at least, you know, in the national capital, and those are the scenes being seen elsewhere as well. One is seeing crowds return to the markets. You know, restaurants are open, malls are open. You know, the advisory that the government has issued comes in the backdrop of the fact that there is a huge spike in cases in the UK again. Moscow is going into a 7-day lockdown. Cases are spiking, you know, across Europe. What is the advice that you'd give to people watching right now?
Well, we've seen what happens post the festive season. There's almost always a spike, whether it's Onam, whether it's Diwali, whether it's Ganpati. So we have to be extremely careful in the coming season. Because, see, we'll have these localized spikes again. India is a huge country. And just because we're doing well at the moment, for the last 3 months at least, we had about 40,000 cases 3 months back, and we've come to 15,000 cases a day. But the low numbers does not mean that the pandemic is over. And we have to learn from these countries. Look at UK, look at Russia, China. Lockdowns are being announced again. Schools are being closed. And we've had a devastating second wave. We have to learn from our mistakes. We can always celebrate from our homes. We can avoid non-essential travel. We can do online shopping, but don't be part of these large gatherings, whether it's a place of worship, whether it's a mall.
Right. Dr. Parikh, you know, what explains this phenomena? And many people have actually asked this question on the fact that cases seem to be spiraling in different parts of the world, where actually the percentage of population that's been double vaccinated is much more than India. But thankfully, so far, and fingers crossed, you know, cases here continue to remain under control. Do you think it's the calm before the storm, or have we actually, you know, managed to contain the spread of COVID?
Good morning, Rishika. Now, this might appear as a bit of a contradiction that on the one hand, we're just celebrating 100 crore vaccinations in our country, and at the same time, we have the advisory coming in. But it's not a contradiction at all. We have to keep in mind that the virus is mutating all the time. There are 24 letters in the Greek alphabet, and my concern is we may run out of all of them. So we've had the alpha, beta, gamma, delta, and then we had the delta plus, which caused this massive wave, not just in our country, but in several parts of the world. And Russia and Britain are grappling with it even as we speak. And even before that variant has petered out, there is a newer variant now, which has just come in. And, you know, that's the AY 4.2, I think it's called.
Yes.
And it's even 15% more infective than the Delta Plus variant, which anyway was 15% more infective than the Delta variant. So the important thing to keep in mind, Rishika, is we should not get desensitized. Because there's been so much talk of COVID now that, you know, we may just not pay too much attention to it.
Yes.
We must also not forget that while we exult over the number of vaccinations in our country, the virus knows no borders. The disease spreads internationally.
Absolutely.
It might be a cliche now to keep repeating that as long as one of us is unsafe, all of us are unsafe. Please, we have to keep in mind that less than 10% of Africa has been vaccinated and less than 50% of the world has been vaccinated. So these are issues of concern.
Right. And I think it's important to note here as well. And Dr. Tikku, very quickly, if I can just ask you, one is hearing again of, you know, cases among the peer group, you know, among people we know, extended friends, family, relatives, of double vaccinated people testing positive for COVID. How do we make sense of this?
See, you can always get infected even if you're vaccinated. See, the idea of vaccination is to prevent hospitalization and to prevent mortality. You can always get infected, but the disease is mild, as we've seen. The efficacy of the vaccines which have been approved is more than 90% as far as preventing hospitalization and mortality is concerned. So the focus, I would say, should be on vaccinating those ones who have received one dose. The second dose is our priority right now because vaccination still holds the key. And mind you, 100 crores is a big achievement, but look at our country.
Right.
Only 31% have received the second dose.
Yes.
So we have to be aggressive with the
All
vaccination.
right. Well, I
And
think
yes,
that's very important clarification coming in there from the doctors that one is seeing a spike elsewhere in the world and therefore we need to tread with caution. And second, that even if you're double vaccinated, you can't let your guard down as you could potentially still get COVID and hopefully it will be a mild infection if at all you contract it. Thank you, doctors, very much for joining us this morning. It is festive season and celebrate we must, but of course with all the COVID precautions.